are singing, the flowers are blooming. No, allergic!
Oh no! He's showing signs of anaphylactic shock. And he's diaphoretic. Call 911.
A few moments later.
Hi, sir. I'm an EMT. Can you tell me your name and if you have any allergies?
My name is Zach. I'm allergic to bees.
Zach, do you have an EpiPen?
I thought they were all dead.
Okay, Zach, we have an EpiPen with us. First, we need to know if you're taking any medications.
Only Flintstone vitamins.
Okay, we're going to have to take you to the hospital afterwards to monitor you for any adverse side effects from the epinephrine.
Okay, Zach, I want to take this EpiPen. I want to put it in your thigh for 10 seconds, hold it, and then just rub the area, make sure that the medication's in, okay?
Okay.
More moments later.
Knock, knock. Hello, Zach. I am Lorenzo. I am the nurse who will be taking care of you today. I see you have family with you.
I'm Amando.
Hi, I'm Lorenzo. Nice to meet
With
you.
brother.
Okay, all right. We're here today because Zach had some anaphylactic shock out in the park due to a bee sting. How are you feeling now?
Much better, thank you.
Great. I just want to tell you a bit about the medication you received before you arrived at the hospital. So, in an adult EpiPen, there is epinephrine at a dose of 0.3 milligrams in 0.3 milliliters of volume. Epinephrine is an alpha and beta adrenergic.
Adrenergic.
Epinephrine is a cardiac stimulant and vasosuppressor. Epinephrine works by strengthening heart contractions, increasing systolic blood pressure, inhibiting histamine release, which has caused your allergic reaction, and causes your lungs to work more effectively.
I'm feeling a little nervous and shaky, and my head hurts a bit. Nurse, am I dying?
No, Zach. Tremors, a racing heart, dizziness, and headache are all normal side effects of epinephrine.
Phew!
We have you on a monitor because we want to watch for adverse effects like hypertension, abnormal heart rhythms, pulmonary edema, and hallucinations.
So there's not a giant bunny in the room? Just kidding.
Now, Zach, you shouldn't have caffeine until the epinephrine is out of your system. We asked you about any medications you take because we want to be sure you weren't any blood pressure medications to increase your blood pressure. We also wanted to be sure you are not taking beta blockers, as epinephrine makes these less effective. Some antidepressants can also increase the effects of epinephrine. We have been monitoring your EKG, and it looks normal. You seem to be feeling much better after your scary morning, so I'm going to go ahead and have the discharge nurse get you started on getting home.
Great.
5 hours later.
Hi, Zach.
Hello.
I'm Nurse Jose. I'll be taking care of you, and I want to go over with you and your brother. Hi, what's your name?
I'm Armando.
Jose, nice to meet you.
Nice to meet you, Jose.
So I'd like to go over with you and your brother how to inject your EpiPen should you need it again. So you know that you're allergic to bees. Can you tell me how you know if you need to use your EpiPen?
Well, I know that if I get stung and have an allergic reaction, I'll have to use my EpiPen.
That's right. And if you start to notice that you're having trouble breathing, are starting to develop hives or starting to wheeze, that's when you should inject yourself, right?
Right.
Okay. Amando, can you tell me again what the symptoms of an allergic reaction are so I know you understand in case you need to help Zach?
Yeah, so if he's stung by a bee and starts to wheeze and gets hives and has trouble breathing, he needs to use his EpiPen, right?
Great. I'm going to show you with the trainer how to administer the EpiPen. First, you take off the blue cap here. Next, you want to inject the epinephrine on the outside of the thigh, push hard right through your pants, and hold the needle in place for 10 seconds. Be careful not to hold your thumb over the needle. After you administered the shot, you'll want to massage the area to make sure that the medication gets into your bloodstream. Now, Zach, I'm going to have both you and Amando try because you might not be able to administer your own EpiPen, depending on how quickly you start to have a reaction. It's always a good idea to let your friends and family know that you carry an EpiPen and where it is so they can help you if you aren't able to inject yourself. Now, Zach, will you show me how to inject the EpiPen?
Okay, so here's the EpiPen. First I take off the blue cap, and then I plunge it into my thigh, and I hold it there for 10 seconds, and then I massage the place so that it'll get into my bloodstream.
Perfect. Now, Armando, do you want to try?
I've always wanted to stab him. Okay, so let's see. I take off this blue safety cap and I inject the outside of his thigh for 10 seconds. And I don't want to stab myself in the process. And then I massage his leg for 10 seconds.
Spot on. Now, you need to call 911 if you use your EpiPen so that they can monitor you at the hospital. They want to be sure that your blood pressure doesn't go too high and that you're not having any heart palpitations or chest pain. Will you tell me what the adverse side effects are so I'm sure you understand?
I could start having heart palpitations or chest pain, so I'll need to call 911 if I use my EpiPen.
Wonderful. I hope you don't have to use your EpiPen again anytime soon, but I'm glad you'll know how and what to watch for if you do. I'll get the discharge paperwork for you to sign.
Thanks, Nurse Jose. I sure hope I don't run into any more of those bees soon.